那我们这边已经串好喽。
好，那我就开始喽。Okay, hello again, everybody. I am Dr. Shen. This is going to be part two of the Medit i700 review from a Sarah user, which is me. So as I mentioned before, in last time, my area of expertise is in aesthetic CAD/CAM restorations in the anterior region. And so what I'm mostly interested is whether this scanner can replace the scanner that we're already using in our clinic, which is the CEREC OmniCam and the Prime Scan. And so just to recap, in case you missed our last discussion, basically, we've already established that the Medit i700 performs very well in terms of scanner accuracy. We did an in vivo test on a live patient, and that's what the results tell us. So it outperformed the Trios and the OmniCam. And because it uses the triangulation method, we already know that it has some of the inherent issues that comes with this method, such as problems with specular reflection, and ambient light pollutions, and a fixed focal plane that can cause problems when things go out of focus. And so this is what we talked about last time. And this is not working? Yeah. Okay. And we demonstrated that this problem in action can actually work in action during a scan. So essentially, the camera will pick up clear images in the focused area and in this focused area here and reject data all around here that are out of focus. But there's going to be an intermediate location where the areas are not quite in focus, but not out of focus. And the software will try to pick it up. And so this is where accuracy issues can happen. So if we know about this, then we can mitigate this problem by knowing exactly where the focal plane is. For instance, if we know that the i700 produces the sharpest image at 10 millimeters right there. Why is my mouse not working? Oh, so right there, then we can try to keep things at that distance as much as possible. And if we fail to do that, then we know that those other areas where if we move too far away or too close are probably areas that we need to keep an eye out for and maybe rescan in certain situations. So this is all from last time. And last time we talked about how I'm going to approach the i700 as a CEREC user, but both as an academic, so caring about the technical specifications. But today, I want to show you a couple of cases that we did when we first started using the i700. So without further ado, let's get into this case. So this is going to be a 3-unit anterior case. So on the left, we have the initial condition that the patient came in with. The patient has 3 old fillings on the anterior teeth, and they're quite anesthetic. But for some reason, the patient, maybe perhaps due to financial problems, the patient has neglected to perform the treatment for a long time. So after the patient came, because his bite is a little bit, what's the word I'm looking for? Unconventional. So what we did first was actually we used the CEREC Prime Scan to create a temporary for him. Okay, so I wanted to test out the occlusion. And at the same time, the patient also wanted to do teeth whitening. So we did a home bleaching kit, and you can see that the teeth bleaching effect, the results are actually quite good. And so on the right here, we have the temporaries and we have the bleached teeth. So I believe this is after about a month of bleaching. Okay, so the first thing we're going to do with the Medit i700 is to scan the initial condition. So the picture on the right is what we're seeing when the patient is now coming in for the single visit restoration. So the first thing we're going to do is to try to scan this. So here is a video of me scanning it, and I've set up some bookmarks. So I will talk a little bit about some things that we can observe during these certain points. Okay, I hope it's going to stop where yes, okay. So right now you can see that we're going to attempt to scan a PFM with a metal on the inside. And all things considered, it's actually doing a pretty good job doing the metal scan right there, right? But you're going to see very quickly that it's going to run into a little bit of a problem. So this is not sped up. This is in real time, so you can get a feel of how fast you can scan with this kind of scanner. And the reason I'm doing the rocking back and forth rocking motion is because this is the This is the recommended way of scanning for the Medit from the manufacturer. So here you can see that even though the metal scanning is turned on, you can see on the bottom here, I've turned on oh, sorry, actually, no, this one hasn't turned on. So because it's not turned on, if the metal surface is too shiny, like you can see here, even though it is in the focal range, it's still not going to be able to pick it up. All right. So let's keep going. And you guys can probably get a feel of how fast this scanner is capable of scanning. Now, noted that this is one of the earlier times of me using this scanner, so I'm not completely familiar with this. You can see I'm going as slowly and as carefully as I can. So right now, we're going to go into stitching, okay? So what you see here is that if I'm scanning a certain area, but the computer is unable to pick it up. So if I'm scanning an area where the computer doesn't recognize, it's going to save what I already have into a new scan and then create a totally new model for this new scan. So you can see that now I have two completely separate scans. So what I scanned before, even though it disappears on the screen, it's actually saved into this temporary file. And if I keep scanning, eventually there's going to be a point where it recognizes where that scan was, and it will snap back the two models into one model. You can see that it kind of lagged a little bit to show that it's now combining the two scans. Now, this is what they call smart stitching, and I think it's probably one of the smartest software feature that I've seen in all of scanning. This is one of those things where if you were using an OmniCam or a Prime Scan, you would think like, oh, if they could do that, that'd be great. I think Medit did a good job implementing this software feature. Now, granted, you do need a very powerful computer to do this successfully because it does take a little bit of time to do the calculations. And so every time that it's trying to combine the two models together, it lags a little bit. Okay. So now you can see me. I think I'm just filling the blue arrows. And I'm going to skip to this point here, and so I want to show you guys that again with the really shiny surfaces, it's very difficult to scan with triangulation method. With something like a confocal with like 3Shape and iTero, they still have this sort of an issue, but it manifests itself in a different way. So most intraoral scanners would have problems with this this kind of shiny material. Okay, and so last time we also talked a little bit about the blue arrows, and so I learned later on that these blue arrows that you can actually turn off if they're bothering you. But I really like having these blue arrows on because it's a very good visual indicator of where you need to fill in the holes, right? So if I'm using a Prime Scan or an OmniCam or a 3Shape, sometimes you can easily miss a hole here or there just because you're not rotating the models in 360 degrees, checking every which way. And so these blue arrows, I think, are really helpful. Okay, so hang on, can I skip to the next one? All right, so after we have the initial scan, the reason why we're doing the initial scan is because we want to reference our temporary, right? So on the left is our original state, which is our temporary. This is the ideal condition that the patient has the aesthetic and the function that he wants. And so we scan that first, then we remove the temporaries, and then now we have the abutments that we're trying to scan. Now, typically when we scan abutments, the way we do this is that we take the original scan of the initial condition, which is ideally what you want. So it's like kind of like the mock-up, and we cut away the areas that we don't want. So instead of rescanning the whole thing again, we simply cut away. Now, in CEREC, there's only one way to cut away, and the way is you basically draw a outline like this. But in other softwares like the Medit, there are other options you can use. For example, you can use a brush, or you can use, I think, like a plane cut. But it doesn't really matter which way you use. You basically have to cut away this area. And I'm going to pause right here. Cut away this area or any areas that you've changed. So in my case, these three abutments that we've changed, and we're now going to try to attempt to rescan these three abutments. Now, right here we have a message after we cut it, telling us that would you asking us if we would like to lock the data. So what locking the data means is that it's going to try to lock the remaining piece of the model, so that even if you rescan over those areas, let's say I'm going to scan this abutment here, and it's kind of inevitable that you're going to scan the other teeth outside of this area of interest. Even if we scan those areas, it's not going to affect the original model. And I think this is a very clever addition to how we scan. So let me show you what happens with if we don't have this option. Sometimes when we are removing a mock-up, for example, there's going to be a lot of debris, like dirt, not dirt, like little pieces of mock-up and lucitemp and maybe resin all around the teeth, and it takes a long time to clean them out. And so if we just if we miss a spot, for example, if we get some resin stuck in like an embrasure somewhere here, and then while we're scanning the abutment, we go over those areas, it's going to try to incorporate those scans into the rest of the model, which we don't really want, right? Because we are only interested in changing the abutments areas here. And so this locking the data is a very useful tool for us to kind of just get around that problem. Okay, so here is the rest of the scan. You can see, again, this is in real time, so you can see how fast or how careful I'm being during this scan. Okay, and from my personal experience as a CEREC user, we've been using CEREC for a very, very long time. It's very easy to pick up a Medit scan. Now notice that right at the very end, go back a little bit, you see that this piece here is cut away by the software itself. And whether this is by AI or by just software algorithms, this is I think one of the most helpful features of modern CAD scanning software. We're going to talk a little bit about that in the next scan. Okay, so let's skip to the next one. Okay, so once we have finished scanning the upper abutments and we're satisfied with the abutment, now we need to scan the antagonist. Right, so we're going to try to establish how much reduction and how much space we have. And so now is the lower scan. Now, a lot of people, I'm going to stop right there. So a lot of people think that lower scans are more difficult because of the tongue, because of the cheek, and because your hands are moving about trying to isolate everything. But in my experience, if the AI is capable enough, like if we go back here, on the right, you can see that the AI recognizes where the tongue and the cheeks are. So it's marking them in purple, which means that it's not going to acquire these images. If the AI is smart enough, then scanning the lower is actually much, much faster than scanning the upper because of the way the morphology of the teeth. And so this all comes down to whether the software has good AI. And for Medit, it has pretty good AI. You can see it in action here. It's actually in real time recognizing where the areas of interest are and where it's not going to try to get the data. Now, sometimes it does make mistakes. Every software has bugs, but it self-corrects, I would say, the great majority of times. Okay, so I'm going to skip to my next point of interest. So here you can see me trying to fill in the little holes for the lower, and because of the crowding in this area, a lot of the times you would get a lot of missed areas. So these arrows are really, really helpful, like I said. So I'm going to stop at the last bookmark here. And I'm going to stop right there. Okay. So here I want to illustrate something that if you're thinking about getting a scanner and you don't know why, sometimes, you swear that you've scanned the entire model, but somehow there's a hole in the middle of the model. And it's because of the way these intraoral scanners are positioned. So inside the head of the scanner, there is a light source and there's a camera. So the light goes from the light source, goes onto the tooth, it reflects off the tooth, and it goes into the camera. Now, because of the physical space in the head, in the scanner, the light source and the camera cannot be in the same place, right? So they have to be split apart. That means the camera cannot be in the middle of the scanner, it has to be off center. So whether it could be off center, toward the tip or onto the side, it depends on the manufacturing. So it's different for Prime Scan, it's different for OmniScan, and it's very different for Medit. So what you see here is actually what the camera sees, but the camera can only see the lights that are coming from the light source. So if there is something that is occluding the light, for example, this area here is in shadow, right, because of the way the light source hits, then it's not going to be able to see it. And so this is why for lower teeth and for upper teeth that that has a huge curvature, a lot of times you would get like holes on the inside, the palatal side of the incisal edge, because that's where the shadows are usually in. Okay, so I really like this image acquisition video on the bottom right, because it can teach you a lot about how this camera scans and its advantages and its drawbacks, and how to mitigate problems. And so it's giving a lot of information for us. Okay, so that is for scanning the lower. So now we have the upper and the lower, and you can see in the AI in action again. Cutting away the excess soft tissue is doing a very good job. It's all very clean. Obviously, there's some holes here, so we're gonna have to fill those up. So the next thing that we need to do is to take the bite. Okay, so for most intraoral scanners nowadays, for the modern ones at least, you are able to scan both sides of the bite. So here you can see that we're scanning one side, and then I think, are we scanning the other side? Yeah, so then we scan the other side. This is not necessary actually for doing 3-unit anterior units, because it's such a short span. You can literally just scan the 3 abutments area. But it's nice to have this kind of feature, to have a full mouth occlusion record, occlusal registration. And it does a very good job, and it works quite well. One of the things I like about this from Medit is that you're able to choose which scan you want to register. So if you are scanning so in my case, in this case, we have actually one lower scan, but we have 2 upper scans. We have the temporary scan, and then we have the abutment scan. So how does the software know which one I'm registering, right? Sometimes you would like to scan the bite registration at the very beginning when you had temporary, but in my case, I decided to do the scanning after removal of the temporary. And so if you decided to actually use the temporary as a registration, you can actually you can choose by just clicking the button here for the software to use different models for registration. Okay, so once we have everything, we have the upper scan, the mock-up or the temporary, and the lower scan. Now we can send it to a CAD design software. Now remember that Medit doesn't have its own design software like 3Shape or Carestream or Serif. It is a scanner only, but it does work very well with ExoCAD. So one of the things that it does is when you export, you can export and then you can choose a package for ExoCAD. So ExoCAD can very quickly pick it up. I believe it can also work if you have the same softwares on the same computer. There's also like a one-click button for you to send it to ExoCAD. But we didn't have that because I was using a Mac version of Medit link, and so I actually had to export it out. So here is I think it's a sped up video of our design. This is really not that important for today's lecture, but just to show you that the whole process for the sake of completion. Okay, so we draw margins, and then we set the path of insertions, and I think then we perform the design. Okay, so this is a single visit restoration, and so things have to be done very quickly. I believe this whole process takes about 25 minutes for our dental technician. Then after everything is done, we mill it. This is the milled product. So because Medit doesn't have its own milling machine, I think only Planmeca and Carestream and Serif has that. So what we actually had to do was we exported it out to an STL and then send it into our in-lab scanner, in-lab milling machine to mill this ceramic, and then we stained it. So here's the milled version and here's the stained version. All right, and here is the final result. So we have the initial condition. We have the well, this is the very beginning, the initial during the consultation. This is the initial condition in the middle for our Medit workflow, and then here is the final restoration. You can see that it's actually very, very similar to the temporary, because we literally just made a biocopy of the temporary because that's what the patient wants. Okay, so I just want to say that when we did these three units, I didn't actually plan on using Medit. It was just that day because we had the Medit, but because the prime scan and the OmniCans were being used by somebody else, so I decided to use it. So there was no preparation ahead of time, and we just did it, and it just worked. So I think in terms of single visit restorations for at least 3 units, 4 units, it is actually quite easy to pick up. Now, the next case that I want to show you very quickly is a full mouth case. So here's a patient with a full mouth resin filling, okay? Resin veneers. And she would like these resin veneers to be replaced with ceramic, okay? So this is going to be a little bit more difficult for the Medit scanner because of now we have to do a full mouth scanning. So here's a video of the full mouth scan. So this is sped up, obviously. And I don't think there's anything of really interest here, just to illustrate that we actually did this case with the Medit scanner. Okay. And I know that if you are a experienced Medit user and you're seeing how I'm scanning this, you're going to think like, what is this guy doing? I'm just scanning using the seric scanning method. So I know it's not going to be perfect, but in the end, the restorations turn out fine. So I guess it all works. So the next thing we're going to do again is to cut away. So now we're going to do remove the parts that we're going to change. And then after we remove the rest, the resin veneers, now we have the final preparation, final prep ready to go. We're going to scan this area back in. So this is again sped up just to give you an idea of what this looks like. Okay. So one thing that a lot of people tend to forget is that when we scan, especially if you're scanning multiple anterior units, because it takes a while to get around from one area to the other, sometimes you get sulcular fluid, gingival fluid coming out. And so you have to keep drying the area, the field of scanning. Now, for the prime scan, this is not much of an issue because a little bit of water, studies have shown that a little bit of clear solution doesn't actually affect its accuracy. Now, I wasn't really sure if Medit is going to have this problem, but we're going to see at the very end that it really doesn't have this sort of a problem as long as the sulcular fluid or any kind of fluid is not too much. It's not too crazy. So here is our 2 scans. So we have the mock-up, or not, sorry, we have the initial condition, right? And then we have the abutment scan. Okay, so everything looks pretty good. Now we're going to run into a pretty big problem. So what is the big problem here? Well, if you look at the way Medit sets up its scans. So here we have a maxilla scan, and then we have 2 maxilla scans. So we have a pre-op, which is the initial with the resin veneers. And then we have another scan, which is like the abutment scan. But that's it, right? And this is kind of an issue for if we're doing aesthetic anterior restorations, because a lot of the time we actually can't use the initial condition as the mock-up, right? Because a lot of the times that's what the patient don't want, right? That's what they want to change. And so the workflow that we usually use for multiple anterior restorations is like this. This is the initial. The next thing we're going to do is we're going to do the preparation, and then we give a mock-up. So this mock-up is the new design that we test in the patient and we discuss with the patient to make changes to. Then we try to copy this mock-up then into the final restoration. So this is our workflow. But if we look at prime scan, right? So this is something that I'm very familiar with. The way we do prime scan is we scan. We have a lower scan. We have an upper scan. This is the abutment. We have the bite, And then we have two scans here. So one is called the biocopy, and the other one in Chinese is called the gingiva scan. So because we have multiple upper scans, that means we can save as much information as we want. This is the initial state of the patient. After we remove everything and then put on the mock-up, then we scan it into here, right? So we're able to keep two copies of the initial, of whatever the initial condition is for reference. Now, obviously, we're going to reference the biocopy because that's the mock-up. But sometimes the biocopy may be misaligned, right? Or maybe the biocopy might not work. Then we'll need to go back and reference the gingiva. So this is how we do it with the steric system. Now, if we compare that to Medit, what you'll see is we have an initial scan, we have an upper scan, a lower scan, and a bite, right? So we're missing that extra scan. And I've confirmed with Medit, and they tell me that they don't have that extra scan for us to use, right? But it doesn't mean that this problem cannot be solved. So after playing around, because after meeting this error, because this sort of a problem actually we realized during the actual single visit restoration. That was kind of a bummer, realizing that I can't use the mockup. So what we actually did was I had to use Prime Scan to scan the mockup, export it into an STL, and then import everything into Exocad to do that. Then later, I realized that we actually don't need to do that. And that's because in Medit, there is an extra scan. Oh, sorry. So here are some corresponding scans. But later, I realized that we don't actually need to do that because Medit actually has something called a face scan. So the face scan, like what you're seeing here, this is actually a scan of one of my patients, is exactly as the name suggests. You can scan the face into your patient's profile, and then use it as a reference. How effective it is, I don't really know, but it does give you an extra copy of the upper scan if you wanted to. So instead of scanning the face, you can use this feature actually to just scan the upper and then keep an extra copy. Now, you're not going to be able to match and align your biocopy with the abutments, but you can always do that in Exocad, right? So this is kind of like a workaround until Medit in the future updates their software to do that. And so here is what we have: the initial scan, the preparation, and then for my case, the mock-up, we actually use the Prime Scan to fill in the with the STL. But in the future, actually, not in the future, we actually did a few more cases, a lot more cases after this. And if I needed to use a mock-up, I always use a face scan. Okay. And then so here is the final restoration. So this is one visit restoration with Medit combined with Exocad. Okay. So we're pretty good on time today. So the very last thing that I want to talk to you about is that, so in the first two cases, we showed that single visit restoration is possible, and it's actually not too difficult if you are familiar with the workflow. You do need an extra piece of software like Exocad or some other design software, and you do need a milling machine. But as long as you have the workflow set up, the actual workflow itself is actually quite easy. Now I want to talk to you about the HD scan. So I used to be a 3-strip scanner at the very beginning, and they also had an HD scan feature. So the HD scan is where you can turn on this feature, this function in the scan, and it will slow down the scan, but it will pick up more information and hopefully at a higher resolution. So I wanted to test to see exactly how much of a difference there's going to be when you turn on HD scan. So I'm going to scan, this is my wallet, and we're going to attempt to scan this. So HD scan, as you can see here at the very bottom, this is HD scan, and I've turned it on. And here is what it looks like when you scan. Okay, so one thing that I want you to notice is that when we are scanning, notice that the model itself doesn't actually turn into the color of the wallet at the very beginning, right? So you can see the edges around here are kind of like this bluish tint. And then as you scan more and more and you kind of rotate every which way, it picks up more and more data, and it gives the color onto the model, right? So that's kind of interesting. It kind of gives like more data, and it tells you how confident the software is of that model. So it's using color as an extra piece of information. All right. So this is HD scan. It doesn't actually feel slower than a regular scan, but we're going to see if it actually is better. So I scanned this wallet using an HD scan, and I also scan it using a regular scan. And here are the results. Okay, so on the left, we have the regular scan. On the right, we have the HD scan. You can already kind of tell that it looks a little bit different. Just look at here in the middle, the circle here. We have much more data and much more like scratches and little details here and there. I'm going to zoom in to take a closer. You can see that the letters are a little bit more legible on the HD scan. So visually, we can see that it is doing something, right? But as an engineer and as a researcher, I like to check these things. So we're going to change them into STL models. The HTL models, you can kind of visually see that these has higher fidelity than these scans, right? You can barely kind of read what's going on here. All right. So after this, we are going to check exactly what is the difference. So by calculating the mesh. And so you can see that HD scan is actually more than twice as many units. So it is actually doing a much better job getting higher resolution data. So what's HD scan used for then? So we know that it's actually doing something, right? And it's giving us more data, and it doesn't actually feel that it's scanning slower. So it's actually really good if you are scanning abutments, right? So in the last couple of cases that I've used Medit with, I've used HD scan basically to scan the entire arch. Now, I think the reason why Medit doesn't want you to use HD scan for the entire arch is because it will run out of memory much faster than using a regular scan, right? But so far, I have yet to run into memory issues just by scanning the entire HD scan, because it is kind of a hassle to try to change between regular scan and HD scan like mid-scanning. So we'll see. Like maybe one day I'll try to push it and see how far I can go. But for abutments, you do get a much more higher resolution and much more clear margins when you use HD scan. So that is a very good feature. So final thoughts. So I've shown you two cases about like whether single visit restoration is possible. Yeah. So I'm going to show you a video of this. And I didn't know I had music. So I'm going to show you a video of this while I talk about the final thoughts, because this video is kind of indicative of how I feel about Medit. So when we compare intraoral scanners in different, from different manufacturers, it's kind of like comparing cell phones nowadays, right? Whether you compare like an Apple iPhone, a Samsung, or Google Pixel, they're all pretty good, right? And so it's really difficult to say which one is the best and which one is the best for you. But one thing that I really like about Medit, besides the fact that its software, its hardware is, it's on par with PrimeScan, with Trios. Its workflow it's very streamlined. But one thing that I really like is the fact that it's giving new features, and it's proactively communicating with the community to give new features. Like this video is showing us a new feature to make a splint, right? So, I didn't know this video was actually this long, so I want to show you the splint earlier. Does everybody need the software to make a splint? No, but sometimes it's good to have this kind of feature when we need it, instead of having to transfer to a different model, to a different software to do a very basic thing. And so I think it's very nice for Medit to listen to the communities and add these features. So over, if you look at the YouTube videos, over the course of the last, I think a few years, they've slowly added, smile design, ortho analysis, crown fit analysis, and then now splint design. And so it is kind of like an evolving kind of a machine, a tool that is slowly evolving over time. And it's really nice to have this kind of of evolution, because honestly, as a CEREC user, it really feels like CEREC doesn't really change very much over the last few years. Maybe there are some software updates here and there, but no really major updates, and you don't really get feedback. You don't feel like your feedback to the CEREC team is being processed. But with Medit, it feels much more intimate, I think, for them to spend their time to add features like this for free, right? And did I mention that it's for free? So it's really nice. And so in conclusion, I guess, is the Medit for everybody? Like I said last time, if you already have a scanner, if you have maybe like a Trios, then the Medit is very similar, so you probably won't get too much of a benefit from that. But if you have something like the Prime Scan or the iTero, which are massive scanners, there are going to be times when you feel like you want a fast, nimble, a very light scanner that can do the job very quickly and very accurately. And so I think if you are just thinking about getting into the intraoral scanning or digital workflow, whether it's orthodontics, whether it's ceramic restorations or implants, I think I think Medit, the i7 is a very good choice. So that is my my presentation for today. So we're pretty good on time. Now, before we go, I want to mention that just a little info about our next CADEC Ultimate Experience. So every year we have a CADEC, the Ultimate Experience, the year-end kind of an event where our team in Taiwan talks about the latest and the greatest in digital technology. And so this year, we're going to have 4 different lecturers talking about implants, aesthetics, zirconia, full mouth reconstruction, and a lot of lab techniques and things to look out for. So it's basically the whole package. And so I believe the early bird price ends tomorrow, I was told. Yes, it says on here 1 day left. So if you are interested in digital technology as a whole, or if you are interested in a certain particular topic, such as Dr. Michael Tao's digital implants and aesthetics and function in implant restoration design, then be sure to contact our course administrations and book your seat soon. So I think there are online versions and also hands-on versions. So that is the end of my presentation for today. Thank you for listening. Again, if any of you have any problems, you can contact me or contact CADEC or Medit, or you can just leave a comment below and we will try to get to everybody. So I want to thank Modern Dental Singapore for their invitation this time for this presentation, and of course for CADEC for setting everything up and doing the streaming. And I want to thank you guys for spending your time on an evening listening to me talk about cases. So that is the end, I guess. Are we signing off? All right. Good night, everybody.